Hey guys, we're going to talk about port access. I do not have Miss Reyes with me today, so it may be a little rough just with me filming by myself. I do have our lovely Chester Chest here. He has an implanted port right here. So you always want to make sure you know where your port is located at. Oop, hold on, let me turn this and kind of show you. So if you can see that risen up area right there, that's where the port is at. And this is what it looks like right here. Okay. A lot of ports are going to have, power ports are going to have 3 little dots in the center here that you can feel underneath the skin. They're going to help you access. You want to try to access for the center, so you are getting it into this rubber area. And when you get it in, you're going to feel the needle hit like the back of the port, which is metal. And it feels weird because it's not, doesn't feel like skin, like when you're sticking somebody. So you're definitely going to notice that when you hit, but that's what you want to feel. It means you're in the right area on the port. And then obviously once you get it in, you're going to be checking for blood return and flushing, and all those things should work also. So this is the port we're going to be accessing on Mr. Chester Chest here. We also have our Huber needle. So I have a Huber needle here. This is should be the same one you have in your kit. This Huber needle, you're going to want to pull this back a little bit so you can see your needle and so you can see where you're inserting. And then you want to grab these little wings right here, and that's what you're going to hold to access. Once you've accessed, you're going to flatten them out and put your dressing on, but for right now, you're going to hold it. That's how you're going to hold it, okay? So this needs to be kept in the package sterile, okay? So we're going to pretend like that wasn't opened yet, but we need that. That does not have the cap on it, and so we have to get a cap, and we're going to drop our cap into our sterile field. And then we also need a saline flush. So this flush I have here is actually a sterile saline flush. We're going to pretend like it's not opened, but if you look really close right here, it says sterile field ready flush syringe, okay? You have to have a sterile field ready syringe. You can't use one of the regular flushes because they're not sterile. So you have to make sure the packaging on your syringe is sterile field ready, which means you're going to be able to drop it in, okay? You can't drop a regular one in, but for, we don't have the ability to have a whole bunch of these, so you're going to have to drop a regular one in. It's going to be really hard, but we're going to give you some grace on that because it's a little harder than this is to drop in, okay? And then you're going to need your central line dressing kit. And these kits, I know a lot of y'all were like, there's no sterile field really with it. It's very small. So we're going to bring a pair of sterile gloves with us. And we're going to use this as an additional field. I'm going to put the gloves on in the kit, but I'm going to have this and I'm going to use that. So you should have an extra pair in your kit. If not, we'll have some available for you. Okay. All right. So let's get started. I'm going to read off of our checkoff sheet, just so I'm making sure I'm staying exactly where we're expecting y'all to be. All right. So first we're going to come in, we're going to introduce ourselves to our patient. We're going to wash our hands. We're going to do our 2 patient identifiers. We're going to check for allergies. We're going to explain the procedure to our patient. If they've had a port for a while, they already know exactly what to expect. We're going to gather our supplies, which I've already showed those to you. And again, we're always looking for, any cuts or rips or discolorations on any of our packaging, and everything looks good. We're also going to assist our patient into a high Fowler's. Really, you can even do semi-fallows, or they can be laying flat. I think it's easier if they're sitting up, but it will depend on what your patient can do, right? So make sure you are aware of that. Now we're going to put a mask on our patient, and we're going to also put a mask on ourselves. I have my mask over here. I'm also going to get some gloves. I'm going to grab me some gloves off the wall. All right, so the first thing we want to do is palpate and assess our port site. Okay, so obviously we're going to ask our patient if it's okay if we can touch them. Okay, so we're going to be assessing our port. We're going to be feeling for it, making sure it's sitting flat, making sure we can feel that rubbery area in the center. I like to do 3 fingers like this and kind of feel where the edges are so I know exactly where I'm going to be going. Okay, all right, so it looks good. We're also going to assess for infection, right? Is it red? Is it swollen? There really shouldn't be any pain. So is there any pain there? It looks really good. All right, so we're ready to go ahead and set up our sterile field and get ready to access. So I'm gonna take my old gloves off. I'm gonna wash my hands. Now I'm gonna move this back a little bit. All right, so the first thing we're gonna do is we're gonna open our dressing kit, and I'm also gonna open up these gloves because I'm gonna use this as an additional field. You know what I like to do? I like to rough up my gloves. Move this down a little bit so you can see. Okay. So this is going to give us a lot more area to drop in. Okay. So now that we have a nice sterile drape, I'm going to take my saline, pretend like this is closed. I'm going to open it up. Okay, again, we're gonna do a throw in, so we're gonna be very careful that we do not throw on that 1-inch border and that we don't touch this sealed edge because that edge is also contaminated. So 1, 2, 3, and that went off. So we're gonna drag that off of our field from the back. See, that is contaminated, right? And this may happen to you. We're gonna do it again. Get a new one, okay? We're gonna throw it in. Okay, beautiful, right in the center. Next thing we're gonna do is grab our cap, okay? We're gonna open our cap very carefully. Again, we need to make sure that this says sterile. So if you look, it says sterile right there, okay? So this is something we can use. We've gotta watch this, that area, that edge is also contaminated, okay? So I'm gonna hold it like this. Again, I'm gonna be very intentional, very careful, and drop that in or throw it in. Last thing is our Huber. I've already taken the top off my package. Again, we're going for the center, right? Real careful, real precise. If it gets stuck in there, it's okay. Beautiful. All right, so let me show you what I got here. I've got all of my stuff in the center of my field. I have thrown it all in. I did have some issues with my syringe, but that's okay. I got it all in there now. Okay, so the next thing I'm gonna do is I'm actually gonna open up this. Remember, I'm not crossing over that. Same sterile rules apply here, right? So this, you can open it up on the table. I'm actually doing it like this because I don't have a lot of room. Okay, I'm gonna pull this all the way off though to prevent any issues here. Okay. All right, so now I'm gonna kind of move some stuff around to make my sterile area work for me, especially since I've decided to do it on the bedside table. I'm gonna use my 1-inch border. I'm gonna pull this all the way down. And I'm not crossing over, and I'll show you how I have it set up here in a second. Okay, so I have this set up like this, okay? All right, so now I need to get sterile. So I'm gonna very carefully, very intentionally get my sterile gloves out of my kit. Very, very carefully, not touching anything else in my kit, okay? So I noticed that when I was doing this, that this little piece of gauze flapped over. That is actually considered contaminated now. So I'm gonna I'm gonna pull that out and throw it away because I don't wanna mess with that. And there's actually another piece right on the edge. So I'm gonna do the same thing with that. And we're gonna throw it away, okay? So it's not in there. I pulled it out from the outside, so I did not contaminate. Got my gloves. We're gonna go ahead and put these on. Okay, we're never turning our back on our sterile field. Okay, I've got my gloves open. Now we're gonna go in for our dominant hand, pinching at the cuff. Okay, step back. We're gonna insert our hand going down. Now you can't really see me. Okay, I'll scoot this way so you can see me. Okay, so I have this hand on. Now we're going in for our scoop, right? I'm gonna grab this. Get your fingers deep into the cuff. Hitchhike your thumb. Now down. Make sure your fingers are going down. Look, I put it on the wrong way. No, I didn't. Got a finger in the wrong hole. That's okay. We're gonna fix it. Okay. Okay. I broke my glove, but we're gonna pretend like I didn't. So now I've got surgeon hands. I'm sterile. I actually don't want to use this and I want it gone. So I'm gonna do that, but still be very careful. You're intentional that you didn't touch anything with that, okay? So I'm gonna drag my stuff back here, okay? So the next thing I need to do is I need to prime my saline. I'm trying to get it where you can see it, okay? So my hands are sterile. This is sterile. So we're going to prime it, okay? All right, so I'm gonna go in, grab my saline. Again, we are sterile right now. We're being very intentional with everything we're doing, okay? We're gonna get that bubble out. I also have to put my cap on. But this is liquid, so we don't want to get any liquid on our sterile field, because what does that mean when we get liquid on it? It is no longer sterile. So I have to take this little blue cap off. Okay. Now I'm going to come closer so y'all can really see. Okay. My elbow kind of went over as I moved, so I wouldn't have done that. Okay. So look, we're going to connect these together right here. Okay. Like that, okay. Okay, once we do that, we're gonna connect this. And we're being very careful not to touch anything. I think I might have touched it when I came to the table, but I wouldn't have come to the table. I just wanted y'all to see. So you're not touching this to anything. Okay, so now we're gonna prime it. And all you wanna do is see a little bit of liquid come out. But I like to prime this off of my field. So I kind of move my hand over a little bit, and then I clamp it so it's not gonna drip. Then I'm gonna set it down, okay? All right, we are ready for that, okay? So now the next thing I'm gonna do is I'm going to grab my chlorhexidine, just like y'all did with your central line, okay? I'm not gonna break this, because if I break it, then I'm not gonna be able to put my dressing on because it won't stick. If you break, check it, right? Then we're gonna go in and we're gonna start at the center of where our port is, okay? And we're gonna scrub out. Now notice my fingers. They're not touching his skin. I have a long wand. So if I need to bring my fingers back, I can, okay? Scrubbing vigorously all over that skin. Big area, everything underneath that dressing, right? Big area. Okay, I don't need this anymore. We're gonna completely let this dry, okay? It needs to dry completely. So we're just gonna say it is completely dry. Now, since the skin is sterile where I have cleaned, this site is sterile right now, okay? So I can touch with my fingers because I am sterile. It is clean, so it is sterile. This is the only time you're gonna be touching on your site, okay? Because you're sterile and it is sterile, okay? So I'm gonna go ahead, I'm gonna get my needle. Y'all, this is so hard to do with the video. I keep reaching over and I'm not meaning to, but I need you to see. So just understand, follow the rules of sterility. Don't reach over. It's just hard whenever I'm trying to get you to see and I'm the only one who's here to video it, okay? All right, so I have this. I'm gonna be very careful holding this, and I'm gonna hold this with my dominant hand, okay? I'm gonna try to move it up just a little bit so you can see. Okay, not touching anything, okay? So now I'm going to, with my non-dominant hand, I'm going to find the center of this port. Make sure I'm not touching anything else, okay? Using 3 fingers. And usually I like to poke at it, feel it, Then I know where I'm going, and I'm just gonna go in and I'm gonna push this down, okay? Oop. Okay, we should be in the port at this point. Okay, so now I'm going to unclamp, check for blood return. Okay, then we're gonna flush. And then I'm gonna set this down, okay? It is not sterile anymore, but it doesn't matter. It doesn't need to be sterile because I'm gonna put the dressing on at this point. I got blood return and I flushed, which means I'm in the port. The next thing I'm gonna do is grab my dressing, okay? Very carefully. If you needed to put skin prep on, you would at this time. So you're gonna put your wings down. We're gonna go at the center of the site, and don't pull your dressing because what'll happen is it'll give your patient some skin breakdown. And again, y'all have heard me say this 100 times. These dressings are terrible, okay? It's not gonna look pretty, but we don't wanna cause skin breakdown. Okay, so now we are done with the sterile portion of this procedure. Really want to make sure that we have a good seal all the way down, all the way around this port, okay? Okay, so now that I'm not sterile anymore, I'm going to bring this in and show you. So you see you have your dressing. Now again, you may not get closure here just because of the type of dressing, but just like the pick dressing I showed y'all in one of the videos, usually they have a reinforced one underneath here to help because your patient may be walking around. All right, so now that you've got this on, you need to do your initial, the date, all those good things, and put it on. Okay, so we've done that. You may need to tape this up, but I like to go ahead and reflush. So we're gonna finish flushing this, okay? All right, so we're gonna flush this out, and I'm actually not gonna fully flush it. But once you're flushing, you're gonna clamp, okay? So you may need to immediately administer medication, which would be a good time to hook it up. Or if, depending on the orders, you're gonna put heparin in this, usually a lot more than you would into one of these lines. So it would depend on what the physician had ordered, but a port has to be accessed once a month. And they're gonna access it and they're gonna infuse heparin in it so it stays in that port. So know that. All right, so we flushed it. Now we're probably gonna take some tape. See if I have any tape around here. I threw my tape out earlier. Let me get some new tape. Okay. And I'm just gonna tape this up like that. Okay. Just so we're not pulling on that insertion site right there, okay? Again, you can see that I have clamped my line. Bring it up here. I have clamped my line, okay? It is full of saline, and we have taped this up so we're not pulling on the insertion site down here because we don't want to pull on that. All right, put this back. All right, let me see here. What else did we miss? Yeah, we talked about checking for placement. Skin prep, if they need it, it's usually a good idea. A lot of people have allergies to the dressing. For him, if you put it on them, it's not going to stick. So we're not going to do skin prep. And then you would document. Make sure you're documenting what type of needle you used, that you use sterile technique, what you cleaned with. You know, that's so important. What you cleaned with, because if you just say you were sterile but you never cleaned the skin, I mean, how are you sterile? So that you clean with chlorhexidine in a vigorous scrubbing motion from the insertion side out. All that is super important. How your patient tolerated, if you had to do multiple sticks, all that good stuff. All right, so our patient is accessed and they're ready to go. So it's, you know, you gave them their infusion or whatever, and now it's time for them to go home. So now we have to de-access it. I know this is not on your skill sheet, and you're going to have to take it out anyway, so I just wanted to go over it. So Again, we're gonna remove our dressing, being very careful. We would have made sure per orders that it was flushed with saline and then the heparin to hep lock it if we weren't gonna be accessing it for a while. So now that you've done all those things, it's ready to be de-accessed. So you're gonna be pulling up on the dressing with a push-pull motion. If I can get a piece of it. Okay. And if it's really sticking to your patient, you can always get some adhesive remover, or you can get some alcohol. So again, I'm pulling up towards the insertion site, away from the actual needle. Okay, so now I like to get it kind of bunched up. I'm gonna come in a little closer so y'all can see. So just like that, okay? So now we're going to put our hands on the side here, on the sides of this Huber needle, okay? This is important for you to know because I actually stuck myself with the Huber needle because it didn't have a safety device. So thank goodness these have them. So hands on the side. Then you're going to pull your wings up, okay? Grasp the wings, and you're gonna pull forward. Let me see if I can hold it this way. Okay, so you see those wings right there? That's what you're gonna be grabbing. Okay, I don't think I can hold it and take it out, but you know what I'm grabbing. So put a tiny bit of pressure on these fingers, and then with these, you're gonna pull out, and you should hear a click. You wanna make sure it's completely in the casing. Now put this in the sharps container. You can use a little bit of gauze. I don't have any. It shouldn't bleed too much, and that is it. So your port is de-accessed. You always want to educate your patient about infection, what they should be looking for. If they notice any of those things, contact their healthcare provider. If you'll have any questions, let me know. I know this was a little rough, but I wanted to give y'all a better method with supplies that you're going to have in the checkoff. So if y'all have any questions, let me know. But remember, I know I kind of went over my sterile field just so you could see. So follow those rules. You're not allowed to cross over your sterile field. You need to be walking around. I just couldn't because of the video and getting close. You know, always in any checkoff, if you break sterility, you just need to state, I broke, this is what I would do. And there's no harm in that because that happens in practice. But recognizing is the key. All right, send me an email if y'all have any questions.